you have to keep an eye on them. And finally, what I would like to address is everything, when we say focus on the patient, I think it makes sense more in healthcare space, health tech space than any other sector, because a discontinuity of service is not going to help anyone. It only increases costs. It reduces the outcome for the patients. So if you are focused on consumer and also focused on how to collaborate properly with the best in the breed in the ecosystem, I think you would attract talent to work with you and for you. So all the very best. And thank you for giving me the opportunity to be here. I'm happy to take any questions if you guys have any questions.
Thank you very much, Vamchi, for doing this. We will take maybe one. If any questions, please put them in the chat box, and Vamchi will come back to you on questions. So thanks very much. And so if there are any questions, please put them in the chat box, and then we will Ms. Vamchi will answer them later. I would also like to, at this point, I'm going to hand over to my colleague, Dr. Busula Shonawa, who's the lead health tech person in ANIDAC. And so she will introduce the panel and moderate the panel. And also for folks who are tweeting on social media, please hashtag the NHEA, the National Health Excellence Awards, and innovation, please. And thank you so much. I think this is the start of a very interesting conversation. Vamchi, you raised some very interesting questions, and I don't know, I hope somebody's going to ask you, what do you do when the economies all start to crash simultaneously across the world? Let's keep that and we'll ask you later. Dr. Shona, over to you.
Thank you very much, Dr. Ege. Good afternoon, everyone. My name is Dr. Busala, and I'm hosting the next part of this webinar, which is the panel discussion. We have 4 panelists. Let me share. So I will introduce each person and they will speak, and then we go to the next. I'll just go alphabetically by their first names. So Chibuzo, I'll start with you, if that's okay.
Yeah, that's fine. Okay. So my name is Chibuzo Opara, co-founder, CEO for Drugstock. Drugstock is a cloud-based pharmaceutical distribution platform that connects manufacturers of good quality pharmaceutical products to hospitals and pharmacies.
Okay, so please share with us what innovations and what lessons you learned during and post the pandemic from a pharma perspective.
Thank you. So I think the first thing is the pandemic sort of struck everybody at a very interesting time. The 2019-2020 period was, an interesting phase of growth. But then for the entire tech industry, I would say, but then with the pandemic, it introduced sort of a decoupling of a lot of tech companies from business as usual to this mega growth, which seems to be tapering off now. But one of the serious benefitors of this was the health tech industry. First of all, it was a pandemic, so health companies in general were particularly sought after and had a lot of potentiation in their markets. And health tech companies which could bridge that divide of having to physically be in proximity with each other, did quite well. As Drugstock, what we saw during the pandemic was an increased penetration of our e-commerce product. A lot of pharmacies and hospitals became comfortable ordering online, and that trend, continued after the pandemic. Another interesting thing we saw was the increased adoption. A lot of new clients came on board and things like that with the digital pharmacy product, and a lot more people were open to the idea of using technology or digital type products, collaborations. We saw a serious number of telemedicine platforms reach out to us during this period to work with us. One of the things that, as a result of that, we elaborated another product that we call Drugstock Access, which basically works with telemedicine providers to service their clients and meet their needs. And the corporate institutions that run tele platforms. So these were some of the things we saw during the pandemic. We also worked with a number of research institutions across something called Drugstock Open API that we opened up, a lot of our data to research institutions. This data is anonymized, of course, from the pharmacy name, but obviously we don't even collect names of patients and things like that, but we anonymized a lot of data from the pharmacies, but we opened it up to research institutions and the like to work together to come up with insights that might be useful to public sector type people or research people who want to publish, a few commercial people, but mostly around research and things like that. So these things that came out of the pandemic, we're still working on them. An interesting challenge that we saw during the pandemic was one around financing. The issue with finance in countries like Nigeria is not just, the ability to pay is an issue with a lot of the population in sub-Saharan Africa. Affordability, like we're all familiar with something like 60%-ish above earn less than $1 a day in Nigeria. But what we also don't think about is the number of people who are unbanked. So number of people who are unbanked, number of people who simply don't have access to financial services or be served by financial services, whether people or businesses, you might be surprised. Sort of that became a stark reality during the pandemic. And some of the things we introduced, we had to go into partnership with some financial institutions to be able to elaborate some fintech access type solutions, not necessarily fintech solutions, but things like that. These are some of the things we kept working on, post the pandemic. Post the pandemic, I think a lot of what we're focusing on is, agglomerating a lot of these solutions into value for the client, such that from a single user access point, a pharmacy can derive and interact with so much value on our system, and even have bigger efficiencies and savings that derive from doing business with us or partnering with us to service their clients.
Thank you very much. Okay, so I will go to Coyote next. Coyote Dengue from Nucleus Africa. Coyote, you're muted.
Yeah, hi Busola. Thanks for having me.
Please, could you put on your video? Sorry. If that works for you. So I'll just go over my questions so that you can just go straight into your answers and then move. So the same question: what innovations, what lessons were learned, and then also what advice you will have for health tech entrepreneurs going forward based on the current landscape of increased technology literacy and all the things Chibuzo has mentioned as well, the increased attention to health tech. Thank you.
Okay, thanks again for having me, Busola. For context sake, right? At Nucleus Africa, we exist with the fundamental philosophy that health insurance is the only way that majority of Africans will have access to good healthcare. So what we've been doing over the last couple of years is building and deploying technologies to the major players, from health insurance companies to the hospitals and to the individuals. Just technology tools that can help them access healthcare in a more affordable and easier manner, right? So for COVID, my answers are not too off what Chibuzo has mentioned. What all of us enjoyed in that period was that there was increased focus on healthcare by everybody, by government, by the practitioners themselves, and even by individuals, right? So for us who play in the tough health insurance space, it was a good time, right? Because people now, the messaging now resonated with much more people, and people know that health insurance is not a cost again, but an investment, right? So it became easier to sell all of our solution to every of the stakeholders, right? Fortunately for us, there are some capabilities that were built into our solution that were very useful in that period, especially in terms of managing operations from different locations, right? And we're able to support all our customers to keep the lights on all around COVID period. To answer the question directly about what the focus should be, I personally believe that for everybody who play around the healthcare space, we don't have the luxury of experimenting or doing just the fancy things, right? We always have to look at what is required in our industry, what is required for the customers, what is required for the stakeholders, for the practitioners, and just attack the problem, right? So the lesson and the advice for everyone will be to keep looking at the problem, right? And the problem is health outcomes. How can we make it better? Everything we are doing must end up at this point, right? So whether I'm building technology that makes people able to afford health insurance or healthcare more cheaply, everything has to still dovetail to getting them healthcare easily and affordably.
Busola, are you there?
Can you hear? Okay, sorry. My microphone went off. Okay. Thank you, Coyote. So we'll go to Marcel now. Marcel is the Chief Digital and Information Officer with Bravo Health. And also the same question, what lessons learned and innovations did Bravo Health go through during and post-pandemic, and also what advice you have for health sector entrepreneurs from your hospital management system perspective? Thank you.
All right, thanks. Excuse me. Thanks, Busola. So sorry, but I have issues with my voice. Thanks, Busola, and thanks to the other speakers. Okay, so just to put a bit of context to this, it will be important to understand some of the challenges there were before the pandemic. I think for us in Nigeria, the entire industry was caught unawares, and this was not also different for the healthcare.